Hello, I'm Dr. Rhonda Johnson. Today is Saturday, April 5th, 2025, and April is Autism Awareness Month. So, first question, do you know a family who has a loved one with autism? I most certainly do, and I've seen firsthand the power of understanding, early support and intervention, and community. That's why I want to share some essential information about Autism Spectrum Disorder, or ASD for short. Now, ASD is a lifelong developmental condition that affects how a person communicates, how they behave, and how they interact with the world around them. The term spectrum means symptoms, and support needs may vary. No two people with autism are the same. Now, ASD is now diagnosed based on levels of support a person needs in two main areas: social communication and restricted or repetitive behaviors. Now, level 1 means requiring support. Level 2 requires substantial support, and level 3 indicates very substantial support is needed. Now, you may remember older terms like Asperger's syndrome. Those are now included under the broader ASD diagnosis, and people also include autism under the neurodivergent category. Now, symptoms of autism usually appear between the ages of 2 to 3 years of age, but some symptoms such as speech delays, limited eye contact, or repetitive behaviors can show up early. Some individuals also have unusual responses to sounds, textures, or social interactions. Now, ASD is a lifelong condition. There is no cure yet, but there are treatments that help. Interventions are most effective when they are personalized to the child. Now, these might include speech and language therapy, occupational therapy, social skills training, behavioral therapy, educational interventions, and feeding and sensory therapies. Now, it's important to remember every child is different, so finding the right combination of therapies with your pediatrician or ASD care team is key, and early intervention makes a big difference. Now, most causes of ASD are still unknown, but we believe a mix of genetic and environmental factors play a role. But one thing I want to be clear and emphasize: vaccines do not cause autism. This has been studied, and there's a lot of evidence to that. Now, ASD is more common in boys than girls, and estimates suggest that autism affects between 1 in 500 to 1 in 40 children. Now, ASD affects people of all racial and ethnic backgrounds, but studies do show that Black and Latino children are often diagnosed later and may have less access to early intervention services. Now, many children with ASD also have other developmental disabilities, and 30% of them may have seizures. Now, there are some genetic or medical conditions like Fragile X syndrome or Rett syndrome that have been linked to ASD, but they make up a very small percentage of cases. Now, diagnosis involves a full medical and developmental evaluation. But one of my key messages here is, parents, if you think something's not quite right with your child, please trust your instincts and talk to your child's doctor. The earlier you get help for your child, the better the outcome for your child. That's my message today. I hope it's been helpful. Take care and be well.